my name's Roberta. I'm the nurse at Ellsworth. How are you guys doing?
That's good. I'm Edna.
Okay, I'm Josie. I'm her roommate.
So what brings you guys in today? What's going on?
Okay, we went to the gym this morning. We just started working out and she just started like profusely sweating way more than she normally does, but she started shivering too and she's like cold, so that's not normal. So I just wanted to bring her in here just to be safe.
Okay, good. I'm glad that you brought her in. That was the smart thing to do. Edna, I'm going to ask you a couple questions. Is it okay if Josie stays or do you want her to step out?
It's okay. I trust her with my life.
Okay, great. So can you tell me a little bit more about your symptoms? When did these begin?
Yeah, I've just been having a really bad headache and diarrhea.
Okay, do you mind? I'm going to just grab your vital signs to get a better look at what's going on. Okay, I'm just going to ask you to lift up your sleeve, please.
It started a couple days ago, and it just gotten worse over the past couple days.
Okay.
Can I put this back in?
Sure. And I'm just going to check your temperature. I'm just going to stick this under your tongue, okay? Okay, your temperature is normal, no fever. And I'm just going to check your pulse real quick. Alright, so your temperature is normal. Your heart rate and blood pressure are a little bit elevated. Have you been feeling any other issues?
Yeah, actually, my heart rate has been racing lately.
Okay, so that explains it. That would make sense as to why you feel that way. So have you been taking any medications that are different than normal?
I've been taking cough medicine. I think it's like cough syrup or something, just to help with my anxiety. And what's the other one? Oh, and acetaminophen for my headaches.
Okay, and how often do you usually take those?
I think I take the cough medicine like 3 or 4 times a week, and the acetaminophen I only get headaches a couple times, but maybe 2 times a week.
Okay. And can you think of any other medications that you've been taking, including vitamins, supplements, minerals, anything like that?
Would herbs be one?
Yeah, that counts also.
Okay, well I suggested taking like, it's called St. John's wort or something, and I heard it could like help with anxiety symptoms because the cough medicine wasn't really working too well, so I suggested she started taking that like a few days ago. Like, is that why she's sick? Like, is that my fault?
Well, no, let's not get ahead of ourselves yet, okay? So can you tell me a little bit more about your anxiety? When did this start?
Well, I've always been really weird about crowds. Like, I don't like being around people at all, and when I got to college, it got so much worse. I don't like talking in class or eating in class. I just don't want people to think I'm weird.
Mm-hmm.
Oh, wait, you tell her about Bernie. That makes you nervous too.
No.
Oh, it's important. She needs
It's
to
okay,
know.
yeah, you can tell me anything here.
Well, there's this boy in my class named Bernie, and I really like him, and I just started taking these medications to maybe help my anxiety because I just don't want him to think I'm weird, and I just want it to be normal.
Okay, I understand. Have you tried anything else to help with your anxiety before you started taking this?
Well, we went to yoga a few times, but that didn't really work out too well.
Yeah, and I guess I tried journaling and writing down my feelings, and that definitely didn't help either.
Okay, well those are a good place to start, so I'm glad that you did try some things. So based on what you're telling me, I'm a little bit concerned that the medications that you're taking, they're causing an interaction with each other, because that can happen when you're taking more than one medication together.
Oh, which medications are you talking about?
So I know you mentioned St. John worts, that's what it's called, and that's often used to help with anxiety or mood disorders because it increases your serotonin levels. And then also the decongestant that you mentioned, that can also increase serotonin levels. Have you guys heard of serotonin before?
Yeah, like it makes you happy or something, like your body produces it if you do certain things.
I think I heard about it, but I don't really know what it means.
Okay, so Josie, like you said, it is produced naturally in your body, and it's to help improve your mood. It's sometimes called the happy hormone. So sometimes when you take too much of these medications and they cause an increase in your serotonin levels, you can have too much of it, and that's what's causing some of these problems that you've been describing.
Oh, okay, so my symptoms are because of my medications and taking them together are causing my headaches and racing heart and
Yep.
profuse sweating.
Yep, and your diarrhea and all those other things that you mentioned, the shivering, stuff like that.
Wait, if that's like why she's having all these things, can she like not take meds for her anxiety for the rest of her life?
Nope. So there's a couple of options that we have. I'm going to give you this pamphlet. These are some other methods that you could use besides medications to help with your anxiety. So we've got a bunch of resources here on Brockport campus that you could try out. Here you'll see we've got Dr. Lawrence. She does meditation classes once a week. Those are a really good option that you could try. We also have a number in here for a counseling service that if you think maybe talking with somebody who's certified, that could help you as well. There's things such as free massages on campus. Sometimes they've got puppy therapy, kind of things like that. So this is a really good source that you could use as well.
And what about my symptoms? Are they going to go away on their own, or do I have to take another medicine to make them go away?
So once you stop taking the St. John worts and the decongestant to help with your anxiety, it should decrease the serotonin levels in your body and your symptoms should go away. Another thing that I really urge you to do though is go see a doctor. A medical provider can prescribe to you an anti-anxiety medication, and that's a better alternative than self-medicating like you've been doing, just because then it can decrease the risk of having these interactions like you've been experiencing. Does that answer your question?
Yeah.
Are there any other questions that you guys can think of?
Well, actually, yeah, I also have been taking a saline nasal spray for when my allergies act up. Can I still take that, or do I have to stop it?
Yep, no, that's not contributing to the serotonin, so you can continue to take that as needed for your allergies. But again, if you notice that any of your symptoms are getting worse or just overall not going away, definitely feel free to come back to me or again, go see your provider. Okay? Any other questions, ladies? No?
Thank you so much.
Well, I hope you feel better, Edna, and I'm really glad that you brought her in today.
Thank you so much for all your help.
No problem. Have a good day.